ultimately we see different folks at different spots in terms of their availability, given the current competing demands. So thanks a ton for joining. This is the second part of a QI discussion that we've been having. We had Meg from CDPHE share some of the principles, and I'm going to have Taylor from CCHN, who's been a fantastic partner, talking about the application of the QI techniques. I know that several of the people on the phone and others have been involved in QI mechanisms that have been funded by CCHN, and then also from the Rural Health Center and also from CDPHE. But in terms of our repository of information for sustainability, we did want to talk a little bit about the applications further and how people are utilizing these, because it can be really helpful, especially for those who don't have all the technical support and programming. So it looks like we have Ali from ACS, Gloria, Laura, and Gayla, all from Valleywide, joining today. Elsa, is there anything else we want to share before we turn it over to Taylor?
Thanks everyone for joining. We will definitely have good time for discussion after Taylor goes through her presentation. This is being recorded, and Meg's previous presentation is already up on the CCSP website, so we will get this one up shortly as well if there's others in your groups that you'd like to share this with who weren't able to join today. And so I'll put that link in the chat during the end of the presentation today, and there will also be an evaluation. So thanks advance for joining us today, and I'll turn it over to Taylor.
Taylor, really quickly, sorry, Elsa and Taylor, I'm going to have to jump off early for another call that got scheduled. Elsa, would you mind at the end sharing the link for the PNTC COVID-19 Navigator resources, just so everyone can see it? And again, huge thanks, Taylor, for all of the support and effort through CCHN this last year. And sorry to interrupt, but just wanted to let you guys know I will have to jump off early. So thank you.
Absolutely, thanks.
Thanks, Andy. Okay, we'll get started, and I'm gonna hope there's no tech issues on my end. Working from home is a little bit interesting that way. So let's see, first test. Okay, did the slide change? Fabulous. Okay, so that's a large photo of me. I'm Taylor Miranda Thompson. I'm with Colorado Community Health Network, and I'm the Senior Quality Initiatives Manager there. So our role is we're the primary care association in Colorado, and we support the 21 community health centers in our state. So Valleywide, you are one of our members. It's great to see so many of you participating. Objectives for today, really we're going to walk through how to conduct a thorough assessment with your clinic team, and then how to prioritize those change concepts that arise from that assessment and start to develop some improvement ideas. And finally, because I know there's been such a large focus on sustainability, I'm going to talk a little bit about some QI tools that you can utilize to develop a nice sustainability plan for your improvement work. So for those of you that were on the webinar with Mag from CDPHE last session, this graphic might look familiar to you. This is the graphic of the CQI process. And I just wanted to bring it back as I was sort of thinking about today's session and thinking about where assessment typically occurs in this process. So oftentimes if you're involved in a QI project, you're doing some sort of assessment at the outset, at the very beginning, just to kind of establish your baseline. But I'd also like you to think about how often your clinic reassesses where you're at. So in addition to your baseline, it's recommended, or it's likely that you'll also want to assess, every 6 to 8 months after that to check in on your progress. And that might seem like it's more often than you think it would be, but I recommend that for a couple different reasons. One, it just allows you to check in on your progress. Two, it really keeps the team motivated. So if you say, we're gonna do an assessment at the beginning of our project, and then we're gonna assess again 3 years later, it's really hard to wrap your mind around, like, where do we want to be in the next 6 months, or where do we want to be in the next 8 months? Instead, you're like, oh, we have 3 years to do this project, we have plenty of time. So it kind of helps break down those little, breaks it down into smaller chunks or smaller pieces at a time. And the third is that it allows you to figure out whether things might have changed from the time that you did your last assessment. So turnover is often a factor with clinics, new staff, staff that have left, new funding, maybe you have new equipment that you can use, all sorts of changes that might have happened, and you can really regroup around how that impacts your goals or how it changes anything. So for the purposes of the rest of the presentation, how I'm going to walk through today, I just want you to think about where you are on your QI journey. So maybe you have a new specific project that you're just starting, and so you're at the very beginning of that assessment phase, or maybe you're at the end stages of a project now and you'll have a final assessment coming up or an opportunity to do a final assessment. So no matter where you are, my presentation should be applicable to you, and just kind of put yourself in that mindset of how could you use these tools that I'm going to walk through today. So that question I have up there is really a trick question. Assessment should be happening multiple times throughout that CQI process. Okay, so some of you might be wondering what an assessment looks like or what it should look like. And the answer is a couple of different things. So you may have an assessment that's specific to a CQI project that you're working on. Maybe you're working with a specific funder and they've provided an assessment or they do an assessment for you. That's fine. If you don't, there are several different resources out there. So one that I'd recommend is the Primary Care Team Guide Assessment, or PCTGA. It's also referred to as the PCMHA. I know that's a lot of acronyms, and that's okay if you do not retain that. I have a link in the resources. But really that one looks at sort of all these different aspects of primary care and how it might be working in your clinic. So the one I have up on the screen here, I know that might be a little difficult to read, but this is one of the components of the Primary Care Team Guide Assessment. And I thought it was applicable specifically to the cancer screening work that you might be doing as navigators or involved in your cancer screening team, looking at planned care. So it's broken down by, if we look at, let's look at number 17. I think that's the most applicable. You know, if a patient comes to your clinic and they're overdue for their colorectal cancer screening, the way that it's organized then from here is like a level D would be kind of the lowest level of functioning, and a level A would be, yes, we do this really well. So for this example, if a patient's coming in and they're overdue for their colorectal screen, a D would be they'd only get it if their provider says, oh, I think, if a provider, you know, goes through a screening with them or notices on their chart that they might be due. A level C would be if you have some sort of alert or something set up in your EMR that tells you this patient's due for a colorectal cancer screening, they're on the schedule, let's get that done, but it's inconsistently used. A B would mean that you do have those alerts, but there aren't really systems in place for somebody like an MA or a navigator or a care coordinator or whoever is assigned to do that scrubbing or notice those alerts. That's not really clear, or there aren't really clear systems in place for that to happen. A level A would mean that you have maybe an EMR or some sort of alert that lets you know that that patient's due. You have folks on the care team other than the provider whose role it is to identify that. And then even taking that step further, maybe the MA or care coordinator or whoever's role it is in the clinic to actually provide a fit test, for example, or make that referral to the specialist for a colonoscopy, and they're given that order to do so. So you can see kind of how this assessment is set up. It breaks it down by the different components and then where you are on that spectrum. So if you've seen this before, sorry for just going through it again, but I just kind of wanted to share this is a really good tool if you don't currently have one to assess how your clinic's working, and it's pretty broad. So there are lots of different topics that apply to lots of different roles. So on that note, when you're doing these assessments, a couple things to consider is, first and foremost, team involvement. So if we were to go back to the CQI slide that Mag showed, the second step on that slide is involving a multidisciplinary team. And that is so important when you're doing assessments. As a coach, sometimes I go in and I see that they say, yeah, we're going to do the assessment and it's going to be with our COO, or we have one medical provider that's going to do the assessment. And we know that primary care is delivered with a team. So all of your team members will have something to say about how the process is working. It's really easy for one person to say, yeah, I think that's working well, or yeah, we do that really well. But sometimes we find that when we get a full team in there to do an assessment, someone might say, oh yeah, that's working really well. And then we have an MA that's there that's like, nope, that's not working at all. That's not how it goes. That's not my experience. So, or vice versa. So it's really helpful just to have the perspectives of everybody. You're all providing team-based care, and you should all be there when you're doing an assessment. Also consider the goal. So maybe you're doing a project specific to cancer screening, or maybe you're doing a project specific to safe opioid prescribing, whatever the topic. You can always use this PCTGA just because it's so broad and focused on primary care, or you could try to answer your questions in terms of how you think it's going relative to that specific topic. Be honest with yourselves in this. There's no reason that you need to score a level A or a 12 on every single one. If you feel like you're really at a 1 or a 2, score yourself at a 1 or a 2. A lot of times these aren't used for the funder. You're not being graded on these things. Use this as a tool for your own improvement. And then finally, to use these types of assessments as a time for your team to have discussion. So I provided coaching on a 3-year project, and actually Valleywide, your EMK site, participated in that. And so we did this PCTGA every 6 months, and it was one of the single most helpful tools that practices shared at the end of the project that kind of helped them move forward. And every time, even if we didn't get a whole lot of team participation in the interim months, or it kind of varied, every time we do the PCTGA, they'd have a full team there ready to share. So it was a really useful tool. And if you want to implement something like this and you're not sure how to get started, I encourage you to reach out to CCHN. I have my contact information. If you're a rural health center, reach out to folks like CRHC or other membership organizations you might be a part of. Any practice coaches you've had for other projects, they can usually help with things like this. Okay, so assessments cover a pretty broad range of topics like we talked about. So that PCTGA that I shared, that looks at empanelment. It looks at how are you partnering with your patients? How are you doing population health management? How are you doing referral management? So it covers a pretty broad range. And once you've done that assessment, you're going to need to narrow down your focus in some way. So one way that I'd recommend, like a next step after you've done your assessment, is to do a follow-up brainstorming session with that same team or a larger team. So here you can think about, what were the items that really stuck out to you when you were doing that assessment? What items rose to the top from your discussion? What items did you feel like you scored maybe lower on that you feel like there's an opportunity to improve on? So yeah, keeping all of those things in mind when you're doing your brainstorming session. The process in general for a brainstorming session, I think, I've seen it done in as short as, 10 to 15 minutes, although I'd recommend if you really have the time, you could spend a full hour-long session focused on brainstorming. Things that you'll need to do this: sticky notes are your best friend here. So the way that I like to do it is give everybody their own packet or stack, whatever you call that, packet of sticky notes and a marker or a pen. Say, provide 5 minutes or so of silent thinking and writing time. So maybe your prompt is, okay, we've just done this assessment. From all of these areas, what sort of ideas do we have on how we want to move forward, or what sort of improvements have we identified that we can make? It can be as super broad as that. Give everyone, 5, maybe even 10 if needed, minutes to just silently think and write down their ideas on a sticky note. It should be 1 idea per sticky note. Sometimes people have 5, sometimes people have 25, like this is really individual. And then once you decide to share out, there's a couple of different ways that you can do that. So I've done it in the past where we just do round robin share out. So go in a circle, share what you have on 1 sticky note, put them up on a flip chart or put them up on the wall. You can also do, depending on how big your group is, something called 2 by 4 by all. So you'd say, okay, everyone get with a partner, share your sticky notes. Do you have things that are the same that you can just kind of condense into one? And then after you're done sharing with that partner, that group partners up with another group of 2. So that's the group of 4. You share your ideas and then you do kind of an all group report out. So that's best if you have a really large group. Round robin tends to work best, I think, in most situations. Work clinics, you're not likely to have like 30 people in the room. You're probably working with a team of 5. So round robin works better. Making ideas visible. So that just means every idea that you share out in the round robin goes up on a wall or up on a flip chart so everyone can read it and see it. And then providing some time for clarification. So after all of your sticky notes are up there, giving folks the opportunity to say, I'm not really sure what that one means. Can whoever put that up explain a little bit more? No judgment zones are super important when you're doing brainstorming sessions. So what I like to say is, like, you cannot provide feedback during the round robin session. If Jessica shares an idea and I'm like, that's never going to work, or that's just like not possible, I can't say that. That's like no feedback allowed. So it really helps if you have someone that can facilitate this for you to kind of enforce those rules. But really, it's just a way to get all of these ideas up on the wall. I like that it sort of flattens the hierarchy. So a lot of times you'll see, if you're not doing brainstorming in this way, maybe you have a CMO that speaks up and says, well, I think we should do this. And then the tendency is for everyone to say, yeah, we should go with that idea because you're the CMO. And while I think that's not to say that CMOs don't have great ideas, that's not my point at all. It's just to say that it allows for a space for maybe who doesn't get to share ideas as often to have an idea that's shared on the exact same plane and the exact same weight as someone who might be in a leadership position. And then the last thing I had here was brainstorming versus brain writing. So that could be done if you don't have time necessarily to do a full brainstorming session. You really just ask people you might send out the prompt via email and ask people to come with their ideas written down on a piece of paper or sticky note to bring to the meeting. The other purpose that it can serve is if you have maybe folks that don't feel comfortable speaking up in a group or sharing their ideas out loud, or maybe you have issues in your clinic with hierarchy or personality dynamics that don't work well together. It just allows people not to have to share out loud in a group setting. So those are options if that's the case for your clinic. So once that's done, and once you have all of your ideas up on that board, sometimes you can do a round 2. So oftentimes during round 1, new ideas spark up and somebody says, oh, I have an idea that piggybacks off of that one. So you can allow for time to do a round 2 or a piggybacking round if you have time. So again, once you do this assessment and once you do your brainstorming, you're probably going to have a lot of ideas, or you might be starting with anywhere from 7 ideas to 30 ideas that you could improve on. And with QA, you'll commonly hear the advice to start small or don't drink the ocean. And it's just simply not feasible to want to improve every different component of your clinic. So when I'm coaching clinics, I always like to kind of narrow down, and prioritization is one way to get at that. So it can be easy, or there can be the tendency to leave the decision up to like one or two decision makers in your organization. And sometimes decisions warrant that, right? Sometimes we need just a leader to decide how are we going to move forward. If your project has the ability to really be driven by your team or have input from your team, one of the most effective ways to do narrowing down and some selection is with something like a prioritization matrix. So I'm sharing a lot of tools here, and I recognize that some of these tools might be familiar to you and some might be new. So I'm just kind of walking you through the process of how I might work on this with teams. So one way to set up your prioritization matrix, you just need two different dimensions. So you can see on the slide here, I have impact and effort. Impact is always a good one because we want to know, is this idea going to make a big impact in where we're trying to go, or is this going to not really have much impact on the way our clinic works? The other axis here we have effort. So really that's just like, how hard is it going to be to implement this thing? But it could be really anything. It could be cost, measuring how expensive something's going to be. It could be the amount of resources you're going to need. It could be perceived difficulty. It could be time it's going to take you. So impact and effort is like a good place to start usually, but it could be, you could get creative if that doesn't serve your needs. How this works is essentially you'll take those ideas that you brainstormed in the step before. So after brainstorming, you'll have a list of sticky notes or a wall of sticky notes. So you'll take those sticky notes, and as a group, you decide where they fall on this matrix. So is this thing going to be really impactful, but it's going to take a lot of effort from our team? You put that in the appropriate area, appropriate quadrant on your chart. Or is this thing going to be super low effort and going to have a huge impact? Great, let's put it there. So typically what you'll want to go for is like those low-hanging fruit or the quick wins, things that don't take a lot of effort and are going to have a bigger impact. Those would be considered low-hanging fruit. It just kind of helps you think like, okay, maybe we should start here because it's going to be a quick win for us. Or maybe you say, you know, we know it's going to take a lot of effort, but we want to go for this thing that's going to have the biggest impact. Or maybe you say we want to go for something that has a medium impact and takes medium effort. You know, there's no right answer there, but this just helps you kind of figure out, here's all of our ideas and how do we start making sense of some of these things. Okay, so this picture I just want to call out. Here's an example of a prioritization matrix that CCHN actually did internally. And this was a little different because instead of sticky notes, we did drawings because we just, we were just feeling creative in the way that we did this. But you can see here, we set up our prioritization matrix. So on the left, you see hard, and on the right, you can't see it, but it says easy. So that was, how hard is this going to be to implement, or how easy is this going to be? And then you can see at the top and bottom, we have high impact and low impact. So all the way on the left here, we have something that was going to be really hard to implement and only had a medium impact. Things on the very top were things that were going to have a super high impact. And depending on where you go left to right, tells you how hard or easy it was going to be to implement. So just kind of a visual of what this might look like in real life. So once you have your prioritization, again, it could be like, not all decisions are going to require a vote, or we're going to require your team to decide. Sometimes it's just one person or leader that's deciding what to do. But if you do have the opportunity to decide as a team how to move forward, or you maybe can get a clinic-wide vote, I wanted to share a couple ways to do this. So one strategy is dot voting. So giving everyone like one dot And you can see on the picture, you can see a blue dot at the very top and a yellow dot over there. So we were in the very early stages of our voting. So giving everyone like 1 dot or 3 dots, or it could be tally marks, it could be whatever, and say, everyone go make your selection for the idea that you want to move forward with, or your top 3 ideas that you want to move forward with. You can do that in a meeting, in person, or you can leave it up somewhere in your clinic. So maybe it's in your break room, and you set up the prioritization matrix in your break room, and then you give everyone a week to put their dots up on the board, something like that. So that's dot voting. It's pretty easy. Multi-voting is just a different version of dot voting. So say you're starting with more than 20 ideas and you want to give everyone 10 dots or 5 dots, and then narrow it down. So maybe you give everyone 5 or 10 dots, you figure out what the top 8 ideas or top 8 vote getters were, and then you do a second round and give everyone 1 dot to pick their favorite. So it's sort of just multiple rounds and narrowing down. Some things to consider if you're doing a voting process. Are you looking to make a unanimous vote? So that might be better done not in this way, but maybe in a meeting where you all decide on an idea together. If you're just looking for majority, a voting process like this might work. You don't even have to do this. You could do a simple hand raise for the best idea. Like, there's lots of ways to do this, but I like the dot voting because I think it's kind of fun. And it's also anonymous, or it can be anonymous. The last thing to consider with voting is, like, how many ideas do you want to end up with? Is it just one? Is it a couple? And then you're going to toss it down the chain. Have you been given the go-ahead to select an idea and move forward, or does it need to go through any other channels? So just some things to think about when you're doing voting. Again, here's just a closer up picture of CCHN's dot voting. So you can see, you can't really see the prioritization matrix, but it's under there. And then we had all of these different ideas, and then we had lots of different people vote. And so you can see this, this one here, that was the very clear winner, which is something that we moved forward with. It's kind of fun too. I think people enjoy participating in these things in ways that they don't always get to do. So I think our team had fun with that. All right, let's see, I may be talking a little bit fast, so I'm already like towards the end of my slides here. The last thing I wanted to talk about was just organizing your work for sustainability. So all of these tools are things that you can do after you do an assessment to kind of determine your next steps. Sustainability, it seems to be like a scary word, or a word that people want to avoid, but it's super important in any project. Usually sustainability is happening at the very end of a project. So you're thinking about, once our project ends, or once we no longer have this funding, how is the work going to continue? How do we make sure that we have the staff dedicated to making sure this continues? How do we ensure that we have the stamina, the motivation to keep going? And then to identify who's going to do the work, who's going to do what, and what's our timeline. So really, that's what sustainability means. For some reason, I think that's a scary word, and people tend to want to avoid talking about sustainability planning, but really it's just like, how are we going to make sure that after this is over, we can continue all the work that we've been doing, or maintain it. Sustainability also provides a shared understanding across your team. So what exactly is going to move forward, and how, and who's going to be the leader of that. It can be super frustrating. I'm sure this has happened to many of you on the phone. It can be very frustrating if team members are working on a project for 12 or 15 months, the project ends, and then suddenly it never gets talked about again. You just drop everything you've done. So talking about sustainability can be a way to help prevent that. And then finally, other topics in terms of sustainability. At some point, along your QI project, you've likely made a tweak or a change, or you've implemented something new. So really just saving time to talk about what are those things that we've implemented, you know, how did we make that happen? What worked well? What did not work well? And if you were to implement something new again or make another change at some point in the process, if something had worked well previously, how do you replicate that? Or if something did not work well previously, how do you avoid that? So it's really just saving space to have those conversations. Coming up on our last tool that I'm going to share with you guys, sustainability planning, it can be done without tools. Like I just said, it could be as simple as let's have a sustainability conversation and make sure we have all of our ducks in a row. But there is one tool that I find super, super helpful when doing sustainability planning. It's really just like a roadmap. I feel like when I refer to it as a roadmap, it tends to sink in a little bit better with folks. So this can be used, you know, a good time for this is as project-specific meetings are starting to die down. So you might be on the last like 3 months of a project, and you want to kind of make sure that after you're done meeting as a project team, or after your funds for the project have gone away, that you have an idea of how you're going to move forward. So this is called a driver diagram. And like I mentioned, it's a really good tool for sustainability, but it could also be used at the beginning of a project as a nice roadmap. So how it's used is just starting from the left side to the right side. The left side is going to be where your overarching goal goes. And then as you move towards the right, you get a little bit more specific. So I'm going to walk through an example, and hopefully that helps illustrate my explanation a little bit better. So we're going to take sustainability planning as our example. Maybe as a clinic, you've been working on a process for cervical cancer screening. And maybe you've been working on it with one provider, MA, navigator, teamlet, and you've really nailed it down. The next step is probably going to be that you want to spread that same workflow to the rest of the teamlets in your clinic. That's a common one that I hear. So in that example, you're working on cervical cancer screening. You've really nailed it down. Come on, here we go. So your overarching goal might be, we want to spread the cervical cancer workflow to all of the pods or all of the teamlets in our clinic by June 30th, 2020. That's going to be your overarching goal on the left side there. I encourage you to be specific. Use those SMART goal format that Mag talked about during the last webinar. So as you move down, you really just kind of break down that overarching goal. So in this example, I have 2 things that stemmed from that overarching goal. So our goal is to spread the cervical cancer workflow, and the way we're going to do that is through documentation and staff training. This third area is even more granular. So what needs to happen in order to make this goal work? So for documentation, let's say that Christina and Dr. Smith are going to document the current process that's working well for cervical cancer screening. And then the second thing that's going to happen in this area is we're going to upload the process to the clinic intranet. If you can be even more specific by adding dates, so we're going to upload it to the clinic intranet by June 1st. Or who's going to upload it? Maybe Christina is going to upload it to the clinic intranet by June 1st. For staff training, it might be something like Christina is the lead MA, and she's going to set up 3 training dates before June 15th to train other staff on this new workflow. The other thing that might happen under staff training is tracking the data by pod, and we're going to do a monthly review. So that'll help us to determine if staff are understanding the process, if it's working well, if they need more training, things like that. So this is my just like very quick and dirty example of a driver diagram and how it's used. I have a blank PDF that I shared with Elsa. So if this is something that you think might be helpful for you guys in your clinic, or just to kind of help organize your thoughts, it can be a super helpful tool. On the last couple slides, I just wanted to share a couple of keys for success when we're talking about sustainability. So definitely assigning next steps and timelines. If nobody has next steps that are assigned to them and nobody knows when they're supposed to get them done by, it's really difficult and things just don't end up happening is what I see. So really be intentional when you're setting up next steps, saying, who's going to do that? Great. I'm going to write down that, Mary says she's going to do this by May 30th. Who is leading the work? Who's going to schedule the meetings? Who's going to facilitate the meetings? Who's going to be taking notes and sharing those notes out with the group? Those could all be the same person, but I recommend you actually breaking out those roles so that it doesn't become burdensome on one person. What are your metrics for success? So how are you knowing that the changes that you're making are actually working? It does not have to be data pulled from your EMR. It could literally be tallies on a slip of paper. So of these calls that we're making, of these outreach calls that we're making to patients, how many resulted in a referral, or how many resulted in a resource being given? It could be a tally every day on a sheet of paper if that's what works for you. And finally, inclusivity. So really that's just referring to making sure that everybody that has a say or that needs to be at the table is a part of that meeting or those meetings. And then finally, visibility. So just some more tips here. This is really like making sure that other folks in your clinic know what's going on in some way, even if they're not involved in the QI work. So you could, the prioritization matrix or brainstorming sticky notes is a great example of that. Whenever we do stuff like that at CCHN, like whenever my team does a brainstorming session, I kind of like to leave it up in either the conference room or a break room or even my office. And as people are coming in, a lot of times they're like, oh, what's that? Or like, I'm curious what you're working on, or I want to do that with my team. So making your work visible can help other people get involved or at least ask questions or kind of learn what's going on. Ways to get the entire clinic involved. So I talked about doing the voting process with your team. That can really help give people the opportunity to weigh in, even if they're not a part of those QI meetings. Gathering buy-in and ownership, I think both of those two things that I just talked about help to do that. And then keeping leaders updated. So if this was a directive from someone on the leadership team at your health center or safety net clinic, making sure you continue to loop them in about what's the progress. Maybe you have some data you want to share. Maybe you just want to share pictures of your sticky notes, or keeping them updated can kind of help with the visibility of your work. Okay, finally, I just have some resources here. So the CCSP has a sustainability planning one-pager that I'm sure you're all familiar with. But that's, you'll see in the sustainability one-pager, a lot of the things that I talked about today kind of help get at those areas. The Safety Net Medical Home Initiative in general is an amazing resource and super easy to access and understand. They have a ton of resources, but the specific thing that I linked here was that primary care assessment. It's a little different than the one that I showed on the screen, but it's very similar. Also free, downloadable, really easy to digest. The IHI has some tools around driver diagrams, so that roadmap sort of chart that I walked through. And then I also shared a PDF with Elsa. And then the CQI portfolio through CDPHE is always a great resource. And lastly, I just wanted to share my contact info and leave some time if we have any questions.
Thanks, Taylor. So I did also just put a prompt for questions in the chat. So Valleywide team, Allie, if you have any questions for Taylor, or if you wanted to share any experiences you've had using any of these tools or similar processes. We are a small group, so we definitely have some time for discussion. If you all wanted to talk about any experiences with these tools or any ways you think you could apply them. I think, as Taylor just mentioned, that this is very applicable to the sustainability process that we're going through with CCSP clinics. So as clinics are forming their sustainability goal, really thinking about those priority domains they want to focus on, building their sustainability plan, or also just trying to actually implement the steps of that outline of the plan, that these tools could absolutely be applied to that. So I'll stop there for a moment. If anyone wants to come off mute, you're welcome to do so, and just see if we have any thoughts from the group.
Hi, this is Laura. And we did do our sustainability assessment through CCSP with you, Elsa. It was a little eye-opening for me. We did ask several disciplines to participate. There were a few that felt like they didn't have anything to contribute, which I thought was a little disheartening. But we got that done, and I'm thinking that we should be able to sustain CCSP within our organization just with the tools and the processes that we have implemented.
Yeah, and Laura, it was great to go through that with your team and see those strengths that Valleywide does have for sustainability, get some of that perspective from multiple team members. And I know that you all were going to have some other discussions, you and Marisa, with maybe some other areas in the organization, such as finance, about the funding stability and just some of those resources. And so I definitely think that Valleywide's in a great place for sustainability, and that any of these tools or processes could be continued to be drawn upon if you needed to do any further discussion with other areas of the clinic. Thanks for sharing that.
And Laura, one thing I would add, you mentioned that you had multiple team members there that didn't feel like they had much to contribute. And that can happen. I've seen that happen a lot in meetings that I facilitate. One trick is, just pointing back to the reason that you invited them. So something I like to say is, like, you are the experts in your role. So really, I can't get the information unless it comes from you, because you're the expert. That's why we invited you. So just really highlighting that you, the reasons that you invited them, because they're the experts, because it's their day-to-day. And if that doesn't bring anything up, something that usually does is asking about pain points. Like, what are the biggest pain points? If you think about from the moment you walk into clinic to the second that you leave the clinic, what's your biggest pain point in the day? Or what are things that always run really smoothly? What are things that always give you a headache? So just some suggestions of maybe if that happens in the future, how to help stimulate that conversation.
Thank you.
And for those listening today, and then those who might be listening to this recording at a later date, I'd also just like to point out that, as Taylor mentioned, these tools can be applied to a CQI process or a sustainability process, or even just some other initiatives that you might not associate with CQI or sustainability specifically. These tools could be really helpful for different forms of decision making within your teams for processes.
I think one other question that I get, because this seems like a lot of work, like all of these tools are a new tool and it's like a new step, they don't all have to be used. They just work well together. So maybe you want to go from brainstorming right to voting. Maybe you don't want to do that prioritization step. That's okay. And sometimes that's all you have time for. Or maybe you just want to go from the assessment to voting. That can be tricky if you don't have individual ideas to respond to. Maybe you want to go from the assessment to the driver diagram. If you know that there's 3 specific areas you want to focus on, that's okay. I just kind of wanted to share these QI tools that seem to work well together in tandem. So, any questions about the tools, or are they new to you? Have you seen them before?
I can say that some of those I was even not familiar with before today, so it's very helpful. I think people appreciate having multiple different tools to choose from, and that because everyone's learning style is a little bit different, having different approaches is definitely helpful. Laura just mentioned in the chat, I've seen a few of them before.
Awesome. Okay, well, I'll just reiterate, Value-Wide, you're one of our Community Health Center members, and I've worked with a lot of your teams before, so, during BSET, awesome. CCHN works closely with the BSET teams too, so that's awesome. Yeah, we are always available, CCSP, CCHN, CDPHE, all of these C acronyms are available for support if you are using these or just have a question, or you want some feedback on something that's happening with your QI process. Feel free to reach out.
Thanks so much, Taylor. And CCHN has been a absolutely wonderful and helpful partner for this work. And so we're definitely going to keep trying to work together and make the resources from our different teams available to all the groups that we work with. So we just wanted to give you a huge thanks for being a huge supporter of all of the work that our clinics do, and being just a really helpful facilitator of resources and making change. And I did just share the evaluation in the chat for today's webinar. Even though we're a small group, would really appreciate you taking a few moments just to let us know what you thought about this webinar, and we'll definitely share that feedback with Taylor. And then I also just did put in the link to the PNTC toolkit for navigation during the time of COVID-19 and dealing with this current pandemic and crisis. And so there's just a lot of good resources for navigators specifically, but could also be used by others in the clinic. And there are some learning opportunities or webinars on some specific topics like managing anxiety and just kind of reflecting on the current time point that are coming up. So thanks, everyone.
Yeah, to that note, thank you for joining in the it's kind of a weird time for everyone. So I appreciate everyone's attention, and stay well, stay safe.
Thanks, Taylor.